Welcome to Health and Harmony Beyond the Teeth, where we dive into all subjects that will help you become healthier and happier. As a dentist, I believe dentistry is more than just teeth. So I created this show to focus on overall health. We will hear from leading experts about eating better, exercising better, breathing better, and sleeping better. We want to help you create harmony in your life so you can live your life to the fullest. We want you to thrive. Hello, welcome to this episode. I'm Dr. Hal Stewart. I've got a very special podcast today. I'm going to be interviewing my dear colleague, my dear friend, Dr. Craig Herre. Craig is also a partner of mine in our teaching center, the Stewart Center for BioRejuvenation and Dental Medicine in Flower Mound, Texas. Craig practices in Leawood, Kansas, and we share the same philosophy of dentistry, which we're going to be sharing with you today. Craig, welcome. It's great to have you here.
Hey, Hal. Thank you so much. It's an honor to be here.
Craig, tell our audience just a little bit about yourself. I know you got a great practice there in Leawood. You practice with your son, Tim. Tell us a little bit about your practice and how it's evolved over the years.
Well, I appreciate again, Hal, this opportunity. Anytime we have the ability to talk about something you and I are passionate about and educate the public and hopefully dentistry, I'm all in. I think I share a similar path as you in that, I came out of dental school with a traditional education, one I was grateful for, and I think they educated us well for the needs that we had back in that time period. But, now that I've been in practice, I'm on my fourth decade, essentially, I realize that the way dentists think and work is a lot different now, and it should be a lot different. And I sort of had an epiphany in the late 90s and understood that I just was not fully equipped to handle some of the diseases and pathologies and problems that were coming into my office and asking me for help. And so I made a commitment to learn more, try to understand what was causing some of the issues. And I think the biggest thing that I learned was that dentistry was guilty of treating symptoms, and medicine is as well. If there's a problem with a tooth, a break, or a crack, we would correct or fix that. But we didn't really look at the etiology or the causative effects as to why those kind of things happen. So when I started discovering that there was a way that we could work backwards and we could figure out why certain diseases and conditions happened, that I really understood more about how to treat the patient, and that evolved into sort of a whole body, holistic approach that we practice now that takes into account, sort of the global health of the individual, and our part of that system is the head and neck, and really the jaws and the jaw joints and the teeth. But appreciating that really changed my life, and I was able to meet people like you, Hal, and others along that journey in our training, and it's evolved and it's continuing to evolve. I certainly feel blessed to have been able to help a lot of patients, many people who I know that I would have tried to pass along somewhere else. And honestly, we're a little bit like Harry Truman, that the buck stops with us, because most dentists are just not educated and capable of dealing with some of the problems and issues that you and I see really literally every day in our practices.
Yeah, well, a testament to not only the dentistry we practice, but a testament to your abilities, Craig. Over the years, I've had the pleasure of meeting some of Craig's patients because if people weren't born in Dallas, they try to get here as quickly as they can. So they moved from Kansas or maybe from another state, but they were patients once of Craig's, and their mouths are always in immaculate health. And the reason for that is because Craig is not a tooth doctor. Craig is a physician of the mouth, and that's what we teach at our teaching center. And so, Craig, why don't you define what Craig and I have coined a term, biorejuvenation dentistry. Explain that to our audience, what biorejuvenation dentistry is and why it differs from traditional general dentistry.
Well, the simplest thing that I could think of to define that is that if you break it down, bio means life, and rejuvenation means to rebuild or restore. And that's what we're doing. And you notice it doesn't say dento rejuvenation, which would be tooth restoring. It's really giving a person back their wholeness and their wellness as much as we can affect within what our discipline can do, and concerning really so much more than just even the mouth, the jaws, and the teeth. We can work with people and patients on nutrition and skeletal health and physical fitness, cessation of habits that are detrimental to their overall health. So biorejuvenation just means that we're able to look again at the whole person and to help them rebuild the damage that's occurred over a lifetime, whether it's a breathing sleeping disorder or a person who had, too much sugar, just whatever the problems are, we have the ability to figure out what happened and why it happened, and then rebuild and restore them.
So it's looking at more than just in their mouth and their teeth. It's looking at how the whole system works.
I think the thing, Hal, that you and I have discovered through our journey is that, as I said earlier, our training was very mechanical. Our training was robotic, and it was necessary, and it's still necessary. But you realize after a number of years of practicing that you know that there's so much more out there, and there's a missing link, and you cannot disconnect the teeth and the mouth from the rest of the body. Diseases, infections, and concerns, problems within the mouth and the chewing system are systemic problems. They're issues that affect a person as much as an infection in another part of the body or an injury in another part of the body. And it takes a lot of effort for the body to try to heal itself. And just like no animal can live without their teeth, the human being is the only one that attempts and tries to. But we find that people who lose their teeth, even with dental implants, are severely compromised in the way of breathing, the way of chewing, eating, communicating. So it's a severe handicap to lose your teeth. And, it's an old axiom that dentistry is built around preventive dentistry. And I always believed that, but I didn't really understand what it was. And I think preventive dentistry is way more than teaching somebody how to brush their teeth and how to take care of their mouth day to day in their bathroom. It's more about understanding that dental health is just like any other part of your body. It takes mental health, it takes exercise and an exercise regimen, good nutrition, and the fourth of that would really be adequate, healthy, good sleep.
Yeah, well, Weston Price, a lot of our audience members might know who Weston Price is, but Weston Price, back in the 40s, maybe the 50s, went all around the world, and he was a doctor, and he looked at these different cultures, and what he found was the cultures where the citizens had most, if not all, of their teeth, even at an elderly age, they all, by and large, lived longer lives and healthier lives than those cultures that did not. And that's not just because they had their teeth, it's because the other factors that allowed them to keep their teeth were intact. So as dentists, we're really trained, like I said before, to be mechanics of the teeth, and like Craig said, almost robotic. In looking at the system, Craig, to our audience, what are we have four key things that we look at as biorejuvenation dentistry, four principles, if you will. Why don't you explain those a little bit to our audience?
Happy to. These are principles that we owe some gratitude to some of our forefathers in dentistry who were so bright and figured out that there's parameters that we see in healthy mouths, and that we as dentists, when we biorejuvenate somebody, when we help restore their mouth back to health, we use these principles or keys as guidelines. And the first one that is just critically important for obvious reasons is an adequate airway. The reason the airway is so important because it affects how we sleep. If you cannot breathe well, if you obstruct when you sleep, the quality of your life is going to diminish significantly, through a very complicated series of effects that go on physiologically in your body. You're not going to be as healthy and as well. So we know that an adequate airway is crucial. And interestingly, the part of the airway that is diminished in most people is inside the mouth, back behind it. And that has to do with the tongue posture and tongue placement. So the number of teeth, the placement of the teeth, how big the jaws are, where the jaws are located, whether they're too far back, all of those things dentists have some control over, but we also have some control over that by the way we live and are raised. And Dr. Stewart brought up Weston Price, and one of the things he found is that people who ate natural diets and exercised and didn't have processed foods and nursed adequately grew bigger jaws and had more room for their tongue, and they ended up thriving more and needing less dentistry. So we put number one as a priority, evaluating a patient's ability to breathe, which when you can't, not only does it cause bad sleep, but it causes other comorbidities that are crucial for our existence. Number two, we need to have a stable foundation of our lower jaw against our skull. If you think of the lower jaw against the skull, it's really very similar to your shoulder, or your knee, or your hip, where it needs to be adequately loaded and braced. The lower jaw really kind of just hangs there. And if we as dentists try to correct the way the teeth fit together without having the jaw braced, it's essentially a moving object. It's a moving target, and it's very difficult for us to get coordination of the jaw and the teeth together at the same time, which is very important for success of the dentistry we do and for the health and well-being of the patient, and for them to live pain-free. Number three, when we chew and we eat, it's really an interesting phenomenon, the way our jaw opens, the way our teeth slide across each other. Our teeth are like knives, and they have to slice through food. And if the teeth do not fit rightly or fit correctly together, or they're dull, they're flat from wear, or whatever it is, they don't have the ability to cut through food and chew food properly. We end up banging our teeth together, causing cracks, fractures, wear. So the guidance of the system and using a phenomenon known as proprioception is how we chew. So we try to rebuild people with a proprioceptive type chewing system, chewing stroke. And lastly, our teeth need to have the form and the shape and the size that they did when they came in. Over life, many people lose certain volumes of their teeth, either through tooth grinding or a dentist grinding on them, or erosion from either acids that they intake or acids that are made within the body. And it can destroy the size, shape, and structure of the teeth. So we know that to have, not necessarily numbered this way, but the fourth parameter would be to have teeth that are genetic in their shape, form, and function.
And anthropologists have shown, studies have shown that enamel, what our teeth are made of, should last about 165 years. So in a properly formed system, we see teeth in elderly patients, in their 80s or 90s that still have their teeth practically unworn. But that has to happen in a system that's formed, that's working correctly. And also, Craig mentioned earlier about the airway. When someone has sleep apnea, we know by studies by Dr. Jerry Simmons, a triple board certified neurologist in Houston, that when people go through apneic events when they're sleeping, they clench and grind their teeth to try to brace the airway, to try to open it up, in essence, to try to breathe. So we can look at someone's teeth and the health of the wear on their teeth and the health of their soft tissues inside their mouth, and have an idea of their overall health. And I've got a lot of trainers. The gym that I work out, over the years, I've met different trainers. They've come to me as patients, and they have these incredible physiques, and they run marathons, and they do this and they do that, and they come in, and their mouth is just horrible. I mean, I'm not saying all trainers have bad mouths. I've just seen this in several people, and I'll tell them, you think you're healthy, but you're not. If you've got inflammation in your mouth, you're not healthy. Now, teeth enamel doesn't become inflamed, but the same result on enamel would be wear. So what we create with biorejuvenation dentistry is systems that operate correctly. And when we restore that form back to the entire system, airway, tooth form, stable joint, the way the teeth interact together, we get not only healthy looking teeth and a beautiful smile, but changes the face of the entire patient in many cases. And I think, Craig, you've got some cases here today for us to look at. So why don't you let's pull one of them up and let you talk about it.
Absolutely, that'd be great. I think one of the aha moments for me years ago was seeing some before and after unsolicited photographs of some patients that were treated similarly to this. And I think that was what motivated me the most. And it's not the aesthetics of essentially the dental smile. It's more globally. You can just see in these people that you're going to see here in just a few minutes. It's not necessarily a dental change, but more a physical change in these people. With this one, for example, I'll give a brief background on. This is a woman in her 30s who has never been able to smile and chew and live normally because her upper jaw did not grow to the right size. And she ended up with a mismatch where her lower jaw was bigger, and therefore her lower jaw stuck out forward. And for her to get her teeth together, she had to bring her jaw way back and try to get the teeth to touch. So it was difficult for her to eat and function and smile. In fact, she lived with a little lift in her mouth, if you will, that she bit on to make her face look taller and fuller. So this was a real challenging case. This person had a significant amount of dentistry and had root canals on many of her teeth. And I was concerned about the longevity of her teeth, trying to do anything that we did. But what we were able to do with her is to give her a bite that fits together more like a normal human bite would be, where the upper teeth overlap, the lowers both sideways and going towards the front. And we were able to rebuild her entire mouth using materials that are very similar to enamel. We are fortunate now that the manufacturers to us that make these products have listened to what we need and have made products with characteristics and properties that are pretty similar to natural tooth structure, particularly enamel. And Hal and I have developed techniques, and when we talk, to anybody that'll listen about how important it is to be conservative with natural tooth structure. Therefore, in cases where we need to rebuild or restore damaged mouths, we try to use materials that we just add on to the tooth. We call it enamel grafting. We're using synthetic enamel materials. So this young woman here, she was significantly concerned about the way she looked and the way she chewed. And by just opening her lower jaw farther and giving her support for her jaw joints and her face and adding to her teeth instead of cutting them down, first of all, it saves her beautiful, healthy enamel. She's still young. It also enhances her smile significantly and gives her a taller volume in her mouth for her to breathe. And if you look at the photographs here, it's obvious that the strain in her neck and her neck posture, pretty much everything about the way she looks on the left as relaxed. It's like she took a big exhale and then just let out a big smile. And I've seen her many times since we did this a couple of years ago. And she is just looking fantastic still. She just finished nursing school and has 2 young children, and now wants to get a doctorate in nursing and is going to go on and teach. And I really think that she probably wouldn't have the self-esteem or the determination to do it maybe if she didn't feel as good as she does now.
Yeah, that's a fantastic case, and we see this so many times. It's not just the teeth that look better or the smile. The entire this young lady's face, she looked like she went back about 10 years.
Exactly. I mean, it's unbelievable.
The picture on
really.
the left, you said she's in her 30s. That doesn't look like a 30-something-year-old. The one on the right does. So that's amazing. And the fact that you do this, Craig, with BioRejuvenation Dentistry, we're not grinding the teeth down and putting porcelain on them. We're just adding to what the patient has ground down themselves. We're just adding that back. I want to be very clear on that. We think enamel's precious, and we don't want to grind that down. Let's look at another case. I know you've got a few more here. Let's tell us a little bit about this gentleman.
Okay, this more of a mature male. Over the years, I had seen him in my practice. In fact, he was a patient of my father's many years ago. And you see somebody every 6 months or so, and you don't necessarily notice the changes. But if you look over a period of 5 years or 10 years, and you look back, it's like, wow. I've been sitting here monitoring and watching this person's teeth just dissolve away. And in this case, we had no idea 10 years ago, really, that the etiology or the causative factor behind this man's dental deterioration was not tooth decay or gum disease, because he really didn't even have a cavity in his mouth, but he had significant sleep apnea. Now, this is obviously not a dissertation today, or Hal and I, we're not talking about cures for breathing and sleeping issues, but we just want to point out that when a person does not sleep well, there are certain things that happen to the mouth. Hal alluded to grinding and clenching, and that's really what went on here. Is he was a significant tooth grinder and then had a lot of acid in his mouth from a reflux disease. That's another side effect of poor sleep. And it basically just destroyed his teeth. And so we were able to go into some limited orthodontics with him and upright his teeth and get them lined up. And then we went through a biorejuvenation program where we essentially gave him back what he was missing. I spoke earlier of the fourth key being tooth form. And how do we know how big to make the teeth and where to put them? Well, essentially, we just put back what Mother Nature had when he was a young man that he's lost over time. So we know that there's certain parameters and lengths and such to teeth, and we'll start in that general range and then look and see what works best for function.
Amazing. And Craig, what are the chances of, if someone like this, that was their teeth were really worn down and they needed to be rehabilitated, and we know that the vast majorities of dentists out there are going to recommend full coverage crowns. And so go over the procedure of when a tooth has a crown on it, what has to be done to it, and wouldn't that also increase the chances of that tooth maybe needing a root canal later?
You brought up something earlier along that point, Hal, when you mentioned an anthropologist said that dental enamel could survive in a human being if we could live that long to 160, 165 years. So that just shows the integrity of what nature has provided for us. It's the hardest structure, obviously, in the body. And when we put materials on teeth that are harder than our natural teeth are, such as the ceramics that we use now and some of the zirconia ceramics that we use, we're actually putting something in there that is not biologic. One of the things about using enamel grafting with synthetic enamel materials is that the properties of that are very similar to natural tooth structure. In fact, they're a little kinder and softer to teeth. They wear a little bit more than teeth do, but they don't damage and cause issues with other teeth. Now, when we do have to do a crown for a tooth, or if we elect to do crowns, say crowns for all the arch of all the teeth, which is there's usually something around 28, we have to remove a significant amount of tooth structure to make room for that crown. We are essentially removing the enamel from the tooth. So it's a surgical procedure. That's why we're called DDSs, or doctors of dental surgery, because we operate on teeth, and they're living human anatomy and structures that are basically evolved from nerves. They're sort of hard nerves, and we take the enamel off. So now what you've got left is sort of the inside of the tooth, and it weakens the tooth considerably. And what we like to call it is, we call it enamel amputation. And in a sense, I think sometimes it's more mutilation than it is amputation. So whenever we can save natural tooth structure and conservatively treat, we're going to elect and I think go that way. I think another thing to consider is that enamel that is missing from a tooth and replaced with porcelain is so hard that it doesn't survive as long as even composite does. And I can tell you this because we have cases going back 20 years. You see very little breakage and very little damage over that time. Whereas if you put ceramic in, oftentimes ceramic will crack and can break. And one of the biggest reasons that we crown teeth now is we're replacing older ones that have failed.
Yeah, so very important. If you are recommended a crown or multiple crowns, that might not necessarily be the best thing for you. And it's not the fault of the dentist. That's the way we're trained. So this biorejuvenation dentistry is it's very unique. And we're training more and more dentists to do this, but unfortunately, there's not enough. And we think that far too many crowns are being placed on teeth out there where they don't really need to be. And again, it's not the fault of your dentist, and your dentist is not trying to do something to, that he or she shouldn't be doing. That is the way that we're trained. But Craig and I have always kind of blazed the path of doing what we feel is more natural, less invasive. And when we look at the whole system, it's really worked out well for us. This is part one of a part two series. The next episode next week, we're just going to go over several cases. We've kind of introduced in the foundations of this, and next week we'll go over 4 or 5 cases, and you'll get to see a lot more of these great cases. So right now, like we always do when we end a podcast, we have our guests choose a song, and we're going to play a little bit of this song. I think probably a lot of people know it. Then we'll let Craig comment on why he chose this particular song.
A child arrived just the other day. He came to the world in the usual way, but there were planes to catch and bills to pay. He learned to walk while I was away, and he was talking for I knew it. And as he grew, he'd say, I'm gonna be like you, Dad. You know I'm gonna be like you. And the cat's in the cradle and the silver spoon, little boy blue and the man on the moon. When you're coming home, Dad, I don't know when, but we'll get together then. You know we'll have a good time then.
Harry Chapin, what a great song.
Harry Chapin died in a taxi cab accident. That song came out when I was a youth, young person, and I always remember the song. I'd have to say that I didn't really embrace it and love it like I do now. It's not so much the song and the music as it is the lyrics, though. I think if you look at how fast life goes by, and you think about the different generations that come and go, having my father, as Hal said earlier, be a dentist, and then having children of my own, and I'm fortunate enough to practice with my son now, I think all songs that we really love speak to us emotionally and personally. And I think when you have family that you care about, and you see how busy life is and how the distractions of life can get in the way, because in this Harry Chapin song, this young boy wants so badly for his dad to be part of his life, and his dad's so busy, he's working and he's traveling, he's on planes and such, that the dad, doesn't really have time for him. And then when the role reverses and the son becomes a man and has his own family, and then his dad's looking backwards and saying, "Hey, son, I'd like to come see you," and then the son's too busy. And it's just a beautifully written song, and I think there's a lot of truth to it. And it's one that I used when my children were young, sort of as a memorialized thing in my head that, okay, keep remembering that they're only young once, and that you need to take advantage of the fact that you only get one shot in life.
Well said, well said. Craig and I both share the same value for the love of family, and when we create harmony in our life, we can help other people better, and being able to create harmony in someone's mouth and their chewing system and their overall feeling of wellness is something that gives both of us great pleasure. And Craig, I want to thank you for being on. We'll pick this up again next week, where we'll just basically look at some amazing biorejuvenation cases that Dr. Herre has completed. So, Craig, thank you once again. This is Dr. Hal Stewart, and we'll see you next week.